Hello, this is Frank Falvey with Frank Presents, and I would like to introduce three important individuals to the town of Franklin. Sitting beside me is Cathleen Liberty, who is the health director. Across from me is Alisha Sullivan, and we have an epidemiologist, Cassia Monteiro. I probably have ruined some of the names, but welcome to this program. But we're going to kind of cover some of the COVID happenings in the last couple of years in various ways. But first of all, I'd like each of you to kind of introduce yourselves, what you do, and what other comments you'd like to make.
Sure. Thank you for having us, Frank. Appreciate it. I'm Cathleen Liberty. I'm the health director for the town of Franklin. I have been here since December of 2019, and I oversee the epidemiologist, the public health nurse, a regional environmental health agent, a health agent, and an administrative assistant for the town of Franklin. And I also represent the Board of Health, which is a 3-member board. So Bridget Sweet is the chair, Jeff Harris is the vice chair, and Timothy Cochran is the member. And so that's an important role that I play in the town.
Yeah, so my name's Cassia Monteiro. I'm a regional epidemiologist for the Metacomet Public Health Alliance. Those towns cover Franklin, Norfolk, and Wrentham. My main duty in this job is to study, track, and prevent diseases in those 3 towns. I also kind of focus on the social determinants of health, whether it be communicable diseases such as COVID-19 or foodborne illnesses, to do case investigations on, or access to care, food insecurity, and other things to help the community as well too.
Hi, I'm Alisha Sullivan. I'm the public health nurse for the town of Franklin. And I also help with case investigations, any kind of communicable or infectious disease. We help educate the public and, make sure that there's no spread going on. I also do home visits, help with medications, vaccine clinics if it's COVID-19, flu clinics, blood pressure clinics. We do an array of things, and what's really important to me is we have been trying to do a lot more community education and programs like that. So that's been a lot of fun to focus on that lately.
What has been your overview of the last couple of years with the coronavirus?
My point of view?
No, your overview.
Oh, my overview.
Overview of what has gone on.
Yes. So the overview for a local public health it's been enormous, an enormous undertaking in that the governor set rules and basically mandates on mask wearing, on the restaurants, on retail stores, and and asked the local boards of health to enforce his mandates to protect the public from the coronavirus, which was an enormous undertaking because, as the governor would say, the local boards of health, but that's just the director. The local boards of health, the boards of health, they don't generally get involved with any type of activities in the health department. So this was really on myself, and at the time, the town contracted with the VNA, and so we had a public health nurse or nurses that did the contact tracing and helped me and guided me because everybody was calling the health department to discuss what to do and how to do it. So it was quite an undertaking, and it had a lot of layers because in the beginning we didn't know anything about the virus, and so I would have people calling that they were so fearful. I've never experienced that before, and how do you put someone at ease knowing that this virus could be fatal if not if not responded to properly. And so then once the fear came, and then the mandates came, and it was an absolute whirlwind for every health director in 351 towns and cities in the state of Massachusetts. I could go on another hour or so, but I'll leave it at that.
Let me say that the death toll nationwide is well over 1 million individuals. And the death toll of those over 65 is well over 800,000 nationwide, which is like 75% that it's been running. This has always seemed to be, to me, a senior disease. It may affect children, it may affect younger people, but it's a senior disease, and I've really never experienced the news media getting into any deep detail as to what's happening in the senior community and where the deaths are occurring, and maybe how to prevent it. So I'd like to begin by asking, as an epidemiologist, how have you found that coronavirus affects seniors particularly?
Yeah, absolutely. So on the health department's website, I have a dashboard there which you can see all the cases, weekly, total, vaccination status, and deaths related to COVID-19, as well as gender, age, and race. So within there, a big thing is with the deaths. All deaths in Franklin since March of 2020 have been people 55 and older. There hasn't been anyone younger than that. But at this point, I think the most important thing for the older community is vaccinations. Stay up to date with vaccinations. Get your primary series, get a booster dose, or your second if it's time for you. We have COVID clinics. We have one on August 10th coming up for booster doses for people. I think just following the Massachusetts Department of Health guidelines to keep everyone safe, wear your mask in indoor spaces around people, try to stay 6 feet apart, don't go into crowded areas, just follow those guidelines, and hopefully people can stay safe.
How many deaths have occurred in Franklin?
I want to say, I brought my dashboard, I want to say 65. 64, 65,
yeah.
I think. It's a lot of data, so can't remember everything.
Around that.
Yeah, 64, 65, I'd say.
And do we track at all where those individuals were living? What kind of setting were they in? Nursing homes? Were they in condos? Were they in private residence? Do we track at all where those individuals were residing?
So I know there have been, outbreaks at, some assisted living communities, but people have been in their own homes too. It's kind of all over the place. I haven't exactly run the data yet. We could. It's a possibility.
Yeah, there
we could
are
do that.
addresses listed for people, and something that we keep track of. We look for trends when we're doing our reports and being on the computer, and if we notice, we know the addresses of the assisted livings, of the nursing homes in the area. So if we see more than one, or even just one, we actually go and we'll call like an infection control person there or a manager, and we'll check in and see how they're doing. And at this point, because we are 2 years into the pandemic, they know what to do, but they still do contact like the Department of Health if they do need help trying to contain a spread. Even though now, compared to 2 years ago, where we were all having issues with having PPE in places to go and keep...
Define what is PPE?
Personal protective equipment. So masks, gowns, gloves. That was an issue a few years ago. People reusing N95s, not having adequate personal protective equipment in hospitals and nursing homes. So now all that stuff is provided, and COVID testing. It wasn't as available a few years ago. I remember I was working in the hospital when the pandemic first happened, and my unit turned into a COVID unit, and I remember we really suspected someone, And it was hard to get the testing done at first because they weren't getting like better with any of the treatment that, you know, it was challenging in the beginning finding what worked. But now we have come so far in the past 2 years, and something else at the Franklin Health Department, we acquired thousands, like 5,000 to 6,000 iHealth, the rapid home test kits, and we have supplied, they're for the community, but we have supplied them to the independent livings and assisted livings, just because if there's a need, we of course want to help.
In a setting like the Housing Authority here in Franklin,
Yeah.
Senior Housing Authority,
Yep.
which is a pretty large complex.
It
I'm,
is.
I'm not sure how many people are there, but it's a great number.
Yeah.
That must have been a special concern of spreading. How did you handle that type of situation?
So I actually probably go there once to twice a month right now. So I wasn't here in the beginning of the pandemic, but I do know the firefighters actually went there and gave people their vaccinations at the Housing Authority. And I'm actually going to be going back there August 10th to go and give boosters for anyone who wants them. We also work with one of their coordinators there, and we provided home tests to them also. And right now, a lot of the things that we're trying to do, like we've just been trying to do activities to kind of get people out of their homes because, and I was one of these people, the pandemic made me kind of isolate. I didn't bring my kids to grocery stores or out of the house, and you know, you kind of all got used to staying in the house, watching what you do, and some people were probably completely isolated, especially if you're living by yourself, like in the Housing Authority, something like that. So, you know, we're trying to have people in a safe way come out and join us and do activities in the community building. And, you know, we provide home tests, we'll provide vaccinations, anything we can do, because in that area, you do get 65 plus residents there.
Go ahead.
Yeah, I was going to address another challenge in the beginning of the pandemic and through the pandemic was memory care. So assisted living that had memory care, or any of the facilities where there may be people living there that have dementia or some type of dementia. And it seemed like those were the folks that were getting COVID. And because they didn't know, they couldn't remember to wash their hands or socially distant, those were the people that were actually causing a problem in these assisted living. And that was really hard because in the beginning I was dealing a lot with you know, the infectious disease nurses and such because once COVID hit, even one person who didn't wash their hands after they coughed or sneezed, or you know, whatever the symptoms were, it would go through the place like wildfire. And it was really just, you know, just heartening because we lost 11 people in one of the facilities in a few weeks, and they were just dropping like flies, and it was really horrifying.
Now that was early on, I gather.
Yeah, it was early on.
So based on that, what did you learn and what practices might have now been put in place?
Oh, so many learning curves. You know, again, memory care, right? They had to, you know, a lot of facilities had to basically just kind of isolate those folks, you know, put them together away from the other folks that may be in a facility for, you know, rehab. Definitely educate the staff. The staff was another barrier, another challenge, because they would have COVID and bring it into their patients, right? So there was constant education. We also I actually had a video on the steps to take of masking, washing hands, 20 seconds, hand sanitizer, social distancing. And many facilities and stores, retail stores, establishments couldn't open until they took this training. And this training came from the state. So we also had to get the state involved with some of these facilities as well. If they didn't have enough masks, they didn't have the proper, you know, resources, I guess I might say, because there's so many, the state would provide these individual facilities with whatever they needed to try and beat this challenge of losing their patients. And with COVID, they could actually be fine 1 minute and then the next minute not drinking, nothing, and just slide downhill. As I'm sure Alisha could attest to, being in the hospital and losing patients, it's really unexpected that they go so fast.
Is that your experience in the hospital?
The first surge, we definitely got a lot of people from nursing homes, and yeah, they didn't fare as well in the beginning. You know, the treatment options are kind of different 2 years from how they were back then. You definitely saw more deaths in the beginning than you do now. You know, the biggest thing that Cassia went and touched upon, especially with the vaccination, I actually have something here from the CDC. So adults 65 years and older who were fully vaccinated with an mRNA COVID vaccine, so the Pfizer or Moderna vaccine, had a 94% reduction in risk of COVID-19 hospitalizations. And even people who were only partially vaccinated had a 64% chance, like, decrease from hospitalization. So those are big numbers there. So, you know, now that we have the vaccines out, different treatment options, even now, look at the Paxlovid that people, that's like an antiviral that they can take when they find out that they have COVID-19 if you're moderately at risk to go and get sick, which, you know, with age, you do have people with more comorbidities, diabetes, hypertension, things like that, that could make you more sick, COPD. So the vaccinations are important. Also, if, you know, depending on what your situation is, if you're immunocompromised, you know, try to socially distance. If you feel more comfortable wearing a mask indoors, wear a mask indoors. Attend things that are outside where the chance of, you know, transmission is reduced.
Do we need to rethink how older people over 65, how they need to live and in what types of settings they need to live in because of this disease could happen in another 6 months? You know, so do we need to think how older people should be living in what type of setting?
So, you know, that's a good question. Unfortunately, a lot of people who need to be in nursing homes and assisted livings, they kind of need to be there. You know, the option to go and be like, I'm going to go and buy a home when they may need like more monitoring or help if it's with their medications, their activities of daily living. That's not an, you know, it's not an easy thing for people to do.
But the facilities like, excuse me, the over 55 facilities, they're really in good shape now.
Yeah.
They're really in good shape. And they, if we had an increase, they would go back to the way they were, you know, setting up the dining rooms, you know, social distance. They would go right back to the practices that we put in place when the pandemic was rampant. And I think that there's a lot of knowledge around this now. There's not, in the very beginning, no one had any understanding of why. Why do people need to be 6 feet apart? Why? You know, why do I have to wash my hands for 20 seconds? Why are you telling me what to do? Was another thing. And so we really worked hard with these facilities, physically going there and saying, okay, you know, let's move these tables apart, you know, measure if you have to. But we spent a lot of time getting these facilities in place to have this policy, right? And I requested policies from the facilities that I would get complaints from. Over 55 communities, I had people calling worried about their mother, their father that were there. Things weren't being done right. And so I would physically go there and say, okay, this is what we're going to do, and you're going to provide me with a written policy so I can hold you accountable. Because it's not it's not getting them in trouble, but it's making them understand that they are that what they do, their practices, affects a person's health. And that was really hard to get through because we didn't have a good understanding of what the pandemic was all about, the virus was about.
even with the flu, I was, because of the COVID virus, I was shocked to find out how many older people die from the flu. I mean,
Shocking.
the number is really quite high.
It is. I don't have the exact number, but yeah, it is on the higher side.
So
for flu.
the COVID is going to mutate and mutate, and it's not, I don't see it ever going away. We're going to have to factor it in like some sort of possible flu shot. If that is the case, we always need to be vigilant against new strains, and we need to come up with effective ways of effective injections. Is that going to be a possibility? I mean, are we going to reach a point that every fall, the COVID, we got to have 2 shots or 1 shot, or?
And no one's talking about it.
Yeah.
No one's mentioning it. And if you look at the flu, right? So there's different strains every year that we have to protect ourselves against. It's the same with any virus in the mutation process. But I'm under the understanding, and I'm not a scientist, that as it mutates, it gets less and less and less dangerous.
Oh, really?
Yeah. So I mean, I could be speaking out of terms, and Alisha might be able to add on to that. But as in the very beginning, the virus was a beast. And then if you think about how it mutates, and each time it mutates, it's not as bad, I guess you might say, in layman terms. And that's the mutation process with any virus.
Yeah,
it's just that COVID was so severe that
it was very severe in the beginning, and I don't know if some of what might be factored in is a lot of people older people did get it and didn't fare well with it necessarily. Like the Omicron and the BA.5 right now are the more dominant ones in the United States, and as we know, they're more contagious, but they're less severe, and those are the ones going around right now.
Well, what concerns me is we really didn't provide a whole lot of help to third world countries. And the virus is still probably much more predominant there than the United States because we haven't simply provided tools to cut it down. And in my mind, at some point, a mutation is going to get worse. Now, this is the first time I've heard that maybe scientifically mutation tends to get less, but I would think it also could go in the other direction.
I think there's a potential for anything.
Get worse.
You're right, yeah.
And so one of my concerns is we need to think not only of the United States, but we got to think of how we help particularly health workers in other countries. Am I off base or?
No, I think you're right. And, in other countries, things could even be underreported if they don't have the same testing capabilities that we have. Even we could see a decrease in numbers, but so many people are doing the home tests now that that's why you could be seeing a decrease in numbers, like statistically. But I agree with you that it could be an issue.
Besides COVID-19, I understand you're probably tracking other types of viruses, and what else do you track?
Yeah, absolutely. So any communicable disease that comes into MAVEN, which is our Massachusetts Virtual Epidemiological Network. So we get notified of any communicable diseases in Franklin, Rentham and Norfolk I also see as well. But I think like the big ones that we can focus on are foodborne illnesses.
I'm sorry, what?
Foodborne illnesses.
Yeah.
I think that's a big one. So, and it's just educating the public what they should be doing, such as when you go grocery shopping, make sure you wash your fruits and vegetables. Make sure you wash your hands, especially after touching raw meat. Don't, cut fruit on the same board that you're cutting meat on, or if there's meat. Just wash your hands, especially after going to the bathroom, maybe changing diapers after picking up. pet feces, things like that. And what else? I think another big one is Lyme disease that we see. So again, educating the community. Make sure when you're outside, you walk in the middle of a path and try not to brush up against like bushes, wear long pants and long sleeves, wear light colored clothing, just do a full body check, make sure there's no ticks on you. Those are the biggest ones that we see, especially that I've seen at least the past 6 months that I've been here. And the biggest thing is just educating the community, doing what we can to make sure that people don't get it. Prevention is the key. So,
I'm really old, and back in my day, lice was a problem in schools for kids. And also, on some occasions, scabies was a problem. Are those two things still a problem, or are they kind of disappeared?
They're not reported. They're not reportable communicable diseases.
Oh, they're not?
They're not, no.
Scabies isn't?
So there's a list of what's reportable, and I want to say those are not.
Who decides what's reportable?
Not me. It's from the Massachusetts Department of Public Health. There's a list, because I keep it in my office just in case. Like, you know, if we work closely with the schools in Franklin, along with, you know, the fire station, places like that. And if they did ever have a concern, they will make sure to always contact us about anything.
Because monkey virus is in the news today, have any cases been reported in the reporting area?
we have not had any confirmed monkeypox cases in
But-
our area.
In
But
Franklin.
that
In
is-
Franklin, yeah. There's been none in Franklin.
But
No.
that is a reportable one, right?
Yes. Yeah.
And I gather special stuff would kick in place if that began to rise?
Oh,
So
so yeah, so this is a learning curve, right? So this is brand new for us. And so what we're we're finding out about contact tracing is I think the hard part about monkeypox is that really until symptoms start is when, and correct me if I'm wrong, so contact
The
tracing.
testing is also limited for monkeypox,
Yeah.
so they want you to actually have like one of the rashes, like the lesions, to go and be tested, and
Yeah.
that usually happens day 5, around after symptoms start. We've been getting a lot of education about this because obviously it is spreading. To our knowledge, it's not like COVID, it's not airborne, but you know how things are ever evolving, so they won't rule out anything, but it's usually contact from the lesions. It can be spread by large respiratory droplets, close contact, things like that, but the lesions are going to be the main way of spreading. So like you can do things like avoid large parties where you're pressed up against people, clubs, areas like that, for like, you know, just for like community knowing the spread. And we focus on even contacts have to be monitored, like a once a week check-in if anyone was a close contact to someone with it. So the Department of Health does want us to monitor everything closely.
I have never had much faith in my understanding of contact tracing. Contact tracing, in my mind, is that if you come down with coronavirus, who have you met?
Yeah.
Right? That, to me, just seemed so ridiculous. And even trying to attempt to do that with the manpower and the cost, how wrong am I about that?
It's a lot. So I worked here in January, and that's when we had the highest amount of cases ever. I couldn't tell. I never got off the phone. I never was off the phone.
But
It was.
was it worth it? I mean,
So-
is there any good out of it?
I focused on educating people, and I said, you contact your close contacts. You know, like in my life in particular, if me or one of my children got it, I would be contacting my family members. And, you know, you just go back the 48 hours, so it's not like we're hanging out with many people, so it'd be easy for me to go and figure that out. But just to give people the education, I think that's the main part, how to help prevent household spread. Because when we call a lot of people, it'll be, you know, you talk to mom or talk to dad, and they have 3 kids in the house. Oh, and grandma lives there too. So we would help teach them that. And even though a lot of people do know what to do, it's, you know, people are scared, people are worried, especially even with this monkeypox being new. You know, some people you call may not even have a primary care provider. So they know that they can get in touch with me and I can send them to the right place and help them with resources. And it's like that with COVID too. You know, I may not have everything off the top of my head, but I do have a list of resources to try to help people. And when we call them and open up communication, they do start, you know, if they have any questions, I may not have the answer for them, but I can provide them a resource. So I understand what you mean. Contact tracing, it's too difficult, especially with the high numbers we're getting. But just to, do you have any questions about anyone in your house? Contact anyone that you know that you're around a lot. I'm not saying contact the grocery store or the post office you went to, but let's say you work in an office and you were there the day before, or, you know, you were with a family member. I would just give those people a heads up, and that's all I recommend to people. I do know what you mean, though. It's tedious. It's crazy at this point. You know, people at this point should take that responsibility into their own hands and contact their own people that are in their life about it.
Well, and that's what's good about the app that the state came up with. So you can do your own contact tracing via that app. I forgot the name of it.
I forget the name of it too.
Yeah,
But
I mean, but they did make people accountable and say, all right, if you have been exposed and you have it, then you have to let people know. That way they can. Otherwise, it's just going to continue to spread. You know, I think contact tracing is very important.
Yeah, you should care about the other people's health in your life, because you don't know what someone's, you know, circumstance is. If someone, you know, they could have a family member with cancer, or, you know what, I was just a close contact to someone with COVID. Maybe I'm not going to go and see my 80-year-old grandmother tomorrow. Maybe I'll wait, you know.
Or even in schools and daycare facilities too. It was an enormous undertaking for the schools to do contact tracing.
Yes.
And I know you've been involved in that
The poor
as well.
schools doing all that.
Yeah.
It was a lot.
It was a lot, but where family is involved, it's important that the family is aware. I think the hardest part was the quarantine. Some families of 4 would have to quarantine for 30 days, making it very difficult for their jobs and you know, just living in general. I think that was the most difficult part for families.
Yeah, I was one of those people. It was terrible.
Almost a month.
Yeah, it was like 3 weeks. It was like 3 weeks because it took each person to go get it, you know.
Yeah.
We went down the line through the house.
And some people are alone, and during isolation or quarantine, you know, we could offer them food, like we could deliver boxes of food to them if they needed it, but a lot of people didn't take us up on that offer, or maybe, you know, I don't know why, but we worried a lot about those people in isolation and quarantine that may be alone. I think that was a very difficult time. Yeah.
And I would, that's an item that crossed my mind, particularly again for the elderly. How did they get food? I mean, I know stores had special hours that they could go in the morning, and now it seems like a big industry to call a store and they'll put it up and you can drive by. But that's more recent than it was during the pandemic.
Yeah.
How did they get food?
So I wasn't there in the beginning, but since September of this past year, a lot of people that I would call, you know, Franklin is a really great community, and a lot of people had family that were helping them, you know, a lot of people did. I remember, and this wasn't actually related to COVID, I was talking to someone, she was having her well water tested, and I remember she was wonderful. I loved talking to her on the phone. She was a lovely woman. And I was like, do you want me to bring some bottled water to your house? But she said her son was taking care of it. Whenever I'd call to check in with her and see how she was doing, I still asked if she needed me to bring her anything, you know. So we, you know, if people did have problems, a lot of times when we were doing the contact tracing, they would communicate that stuff to us. But a lot of people seem to have family in the area, family that stepped up. But I do agree with you. It is, you know, worrisome if they really did need something and maybe we're too prideful to ask. Something we're actually been doing the past few months is we've partnered with the Franklin Food Pantry. They're such an amazing organization in this town, and they're doing mobile food pantries now, and we have started that at the
Housing Authority.
thank you, the Housing Authority in Franklin, and we're going to be doing that once a month.
Yeah, we're trying to address food insecurity. And so that was our way of partnering with them.
Yeah.
And I think it's every fourth Wednesday.
Yep.
Every fourth Wednesday of the month, and they have shelf-stable food, produce, dairy, and meat products.
Yeah, so
as
many
well, too. There's-
things.
Yeah,
They do
so
a
much
great
food.
job.
I have an unusual question. Have you ever heard of the nursing corps?
And I haven't.
The nursing corps.
What they do.
I don't know, but in the Biden COVID relief bill, there was money that went to a nursing corps and money that went to some local affiliate, not necessarily here in Franklin, but in the bill for some sort of organization that people, doctors and nurses, and formed like an emergency council or.
Probably
Okay.
the Medical Reserve Corps.
You think
Yeah,
it's the
Medical Reserve
Oh,
Corps.
okay.
Yeah.
Yeah, they're.
We actually met great people from that to help with our vaccine clinic. So we were one of the first people, to go and jump on the 5 to 11 vaccines when that was coming out. That was like a big undertaking that we did. And we needed vaccinators because our clinics would fill up. We'd have 300 at the 2 big ones that we had in the beginning. And we got vaccinators from the Medical Reserve Corps to help us. And they're wonderful, a lot of them have vast experiences, and, especially the pediatric nurses. That was great to have them there to vaccinate children.
Franklin belongs to the Greater Grafton area for
Yeah.
the Medical Reserve. So in the very beginning, when we did the first responders clinic, I didn't have a public health nurse, so I reached out to the Medical Reserve. And as it turned out, we didn't need them at the time, but they're Johnny on the spot. They're wonderful. We actually still have one of our Medical Reserve that Rentham hired as continuing contact tracing for us. So they were a real lifesaver. I don't think we use them for the first responders, but definitely for our vaccines for the children. Yeah, they're great.
So that a lot of funding in the Biden COVID program went to them. What has filtered down to the town of Franklin from that COVID Biden relief plan?
I think that would be more of a question for the town administrator. That he managed.
Well, I mean, in the medical, are
Oh.
you funded out of the Biden
I
plan?
don't think so.
No, she's not.
She's not.
No, well, not that I know of. We're funded. The epidemiologist position is funded through the DPH, Department of Public Health.
State.
Yes.
State Department of Public
Yeah,
Health.
they provided shared services grants for towns who wanted to literally share services. The DPH has always encouraged us to regionalize, in a sense, and so Rentham is the host. Basically, they wrote the grant and received the grant, and then Franklin and Norfolk joined on, contracted with Rentham to have these services.
So it's possible, but the state
Possible.
got money.
Yeah.
What in your epidemiology tracking might surprise me that some numbers or some unusual some disease that I've never heard of it pops up, or is there any
I don't know if I'd
anything
say
the public?
unusual. I mean, I do have a lot of COVID data if you're interested in for the town of Franklin. I mean, percentages, numbers based on age, race, gender. If you're interested in any of those, I have them here. But a lot of it's just COVID data that have been my main focus to try to get those numbers for Franklin.
Yeah. What might interest you is the tick viruses. So there's not just Lyme disease, and that there is
Babesiosis and
Babesiosis.
anaplasmosis
Yeah.
are other, like one's parasitic and I think another one's like bacteria caused. But yeah, these ticks have bacteria and can infect people. Lyme disease, of course, is the big one
Yeah.
that everyone knows about, and there's no case investigation that goes with Lyme disease. But with anaplasmosis and babesiosis, people get very sick. A lot of times they're hospitalized, and that's how they find out that they have it, because they can have like anemia, liver problems, things of that sort. So they can become very sick. So we do have to do a little bit of investigation into that.
There's a town not far from us that they test for flies, right? For they capture flies.
Like the Tripoli and the West Nile, is that what you're talking about?
I guess so.
Mosquitoes.
Yeah, the mosquitoes.
Oh, the mosquitoes.
Yeah.
And there's a town not too far from us that always seems to be the first town in Massachusetts that discovers that. Does that fall under the...
So it is something that we monitor, and right now Franklin is still considered low, and I don't think there hasn't been any test samples in Norfolk County, I think in general, that have had positive West Nile. I think you're talking about West Nile. They have found in 8 different samples in Massachusetts, but nothing has been in Norfolk County to my knowledge. I do check it once a week. I try to do like weekly reports, and I do look into that.
Yeah.
But yeah. And the biggest thing, you know, we do education. Like one of the things that we focused on was Lyme disease, and I know it's a little different than the West Nile and things like that, but part of our focus was, you know, the bug sprays and teaching about safety with bug sprays. It's not something that people even really think about. I remember when I was a kid, I'd spray myself a million times with like DEET, you know, and you're not supposed to do that, it turns out. So we provided education at the Franklin Senior Center and the Franklin Library about Lyme disease, and just focusing a lot on symptoms, what to do, and then a lot on the products, because I thought that was very interesting that people might like to know.
This has intrigued me about education, okay? And how do you educate people to different problems? I'm greatly concerned about older people being scammed. Either over the phone, over the computer.
Yeah.
And I haven't come up with a way that really reaches older people to educate them. Have you found problems in trying to educate a vast majority of people to different programs?
So I can see what you're talking about. I don't, you know, my Lyme disease might not have gotten tons of people in because it may not be something that people are interested in, but I do think places like the senior center and the library are great places to maybe host something like that. The senior center gets tons of foot traffic.
Yeah.
You know, if you went and spoke to one of the directors there and wanted to organize something like that to put out in the newsletter, I'm sure you would get great success, because I think the newsletter is key. And if you wanted to do like a class like that on things to watch out for, because our office is out of there, and it's a very busy senior center. They do an amazing job.
How about on, I'm not a computer person, okay, but how about, do you develop stuff with a computer, like a topic? In other words, I have Frank's music on SoundCloud, right? And so a lot of places just advertise or have a thing on the website. If you put in Frank's music, Falvey, I'll come up. Do you develop on the computer, say, Lyme disease or information for seniors on viruses? I mean, is there topics that if you named a topic, people that might be just searching come across to?
They could go and get access to it.
Yeah.
That's something we can definitely look into. Right now, the dashboard has been her biggest thing, updating
Okay,
statistics.
what's the dashboard? What's the dashboard?
Yeah. So it's a COVID-19 dashboard. It's focused on COVID-19. It has weekly cases, total cases, vaccinations, and COVID-related deaths. All of those have the people's ages, race, and gender. So that's the updated weekly with all percentages and everything you can think of on there about COVID
Well,
relating to each town.
Please put where they died. Their house, you know, I think what would really be important, were they living in their house? Were they living in condos? Were they living at the
Yeah, we'll have to see how we can do that while still
That seemed-
protecting people's information.
Right.
You know, we can.
And the death.
Yeah.
Oh, go ahead.
What is the last thing that you'd like to make comments about? What haven't we covered that really is important that you'd like to talk about?
Well, I think we covered a lot, and I'm glad we're still talking about COVID-19. I think that's still important because I feel like, you know, monkeypox is here, so COVID gets swept away. So it's still important to remember that COVID is still here, and it's, you know, it's not going anywhere either. So I'm glad that we discussed that and all of the communicables that we deal with. Like Cassia was saying, food safety, and we want to protect the public for Lyme disease or any type of tick-borne viruses. And more importantly, we're starting to fight food insecurity. So these are all really, really important things that we do. I think I am so happy with each individual in the health department and every role that they play. So we have an inspector who actually inspects homes as well. So we do a lot of education in the homes, where we just had a case where a young child was living in possibly unsanitary conditions, and we don't go in as bullies. I'd like the public to know that we go in to provide education and how can we help and what resources do you need or are you lacking. And a lot of people, when we go into their homes, it's an invasion. So, and they're afraid when the Board of Health calls or the health department calls, with, you know, because we received a complaint from police, etc. But my staff is just they have empathy, they have sympathy, they're just wonderful out in the field. The health agent is fantastic. So, and we all address, I think we all address all of the public health issues together. I actually kind of go outside the box a little bit, and I started doing podcasts with Steve Sherlock addressing public health issues that have increased during the pandemic, such as domestic violence and neglect and mental health, substance use. So those topics are still very important to me, and not topics that we talk about at the dinner table. So I guess I could talk about public health forever, but public health is everywhere, and our health department is here for our community in many, many ways that we can contribute to.
Yeah, absolutely.
Yeah.
If anyone has any questions too, you know, they can always reach out to us at the health department. We may have resources that they don't know are available in this town, because this town does actually have a lot of resources out there for people, and nothing's too small, even though public health you think community-wide, but I've even, you know, helped people with weekly medications and things like that. You know, nothing is too small to see if we can go and help someone in the community.
Alisha, Sullivan, what if people want to reach you? How could they do that?
So best way to reach me would be calling my office, and the number's 508-613-1334, and that's my direct line.
All right. And Kathleen, Liberty, how do they reach the Board of Health and you as the director?
Same here, 508-520-4905.
And does the Board of Health meet publicly?
Oh yes, we meet once a month.
And when and what time?
We meet the first Wednesday of every month at 5 p.m. at the town hall.
All right.
Yeah.
And do you, Cassia, deal with the public, or is most of your work just statistically?
No. I work with the public too. I get phone calls all the time. So if anyone ever does have any questions about COVID, any other disease, or need resources, they can call me at 508-613-1341. You can also use that number. We're handing out COVID-19 test kits to the public. And all you have to do is drive up to the senior center, give that number a call, and I'll run them right out to your car as well too. So,
well, I would like to thank all of you, and hopefully we can at some time get together again and do some follow-ups, because we haven't even covered the authority of the Board of Health, and the power that you really do have a lot of power and authority in health issues.
Actually, yes. So the Board of Health is actually one of the most powerful boards there is, in that they set policy, and they can actually make state regulations stricter. So they're. I don't think they know how powerful they are, but they are, and I represent them. So I get my power, my duties from them. So.
So this is Frank Falvey with Frank Presents, wishing you a great day and a healthy rest of the year. And please, if you have any comments, call the studio, 508-541-4118. Thank you.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.